Welcome back to the Morning Blend. Problems with your jaw? Treatment options are available that can help alleviate pain and discomfort you've suffered with for years.
That's right. Here with more is Dr. Joseph Willardsen of True Dentistry. It's great having you back, buddy.
Good to be back.
Good morning.
I've heard of TMJ before. What does TMJ stand for, and how does it happen?
TMJ is a temporal mandibular joint. It's actually this joint. And so when people hear or have been told they have TMJ, it's actually temporal mandibular disorder. And so what happens is when the teeth come together and those muscles begin to fire, if the teeth don't work evenly, those muscles will fire differently, and that can cause headaches and neck pain and all sorts of problems.
And again, you mentioned that's TMD.
TMD. But most people would know it as TMJ.
Okay.
So it's when there's an imbalance, we see that those muscles will create pain like headaches and neck pain, popping and clicking, all sorts of things like that.
And how do you solve that problem? Any type of treatments?
Yeah, so what we do is we use what's called jaw tracking. And jaw tracking allows us to find out where the jaw is most comfortable. And as the teeth come together, it will allow us to figure out where the optimal position where the bite should be. So you can see here, as the teeth are apart, you can watch the patient bite down, and as the patient slides forward and relaxes, we can see that position there is where the jaw wants to be rather than being...
Wow, that's incredible.
Yeah, it's cool.
So then once you see that information, how then are you able to apply that to a treatment?
Okay, so once we have that information, from there we make what's called an orthotic. And this, kind of like an orthotic in a shoe.
Yeah, I was going to say
kind of
orthotic.
balances everything out. So here we can see we use this orthotic.
It looks a little bit like an Invisalign.
It does.
Okay.
It's a little bit thicker than Invisalign, and it goes on the lower teeth.
Okay.
And so now once the patient bites down, those back teeth connect, everything hits at the same time, and that equals out the motions in the muscle.
So some of those back teeth, this back tooth might be a little shorter than that back tooth.
Exactly.
And this evens it all out.
Exactly.
Okay.
You know, a lot of times patients will say, well, yeah, I chew on one side of my mouth more than the other. Or you know, the teeth are worn down or chipped or cracked.
Yeah.
So there's lots of different signs and symptoms to tell if you have TMJ. If you have neck pain, chronic migraines, sore biting muscles, popping and clicking of the joint, worn down chipped teeth, crowding. These are all signs that you may have a bite issue, which could be contributing to TMJ.
And if you do nothing, what happens?
The teeth will wear down. You'll live in chronic pain. So there's...
it's a Pandora's box of more dental stuff.
Exactly. That's right. And just as much as gray hairs or wrinkles are a sign of age, so are worn down, chipped, yellow teeth. And it's like when your car is out of alignment and the tires wear down. If the teeth are out of alignment, the teeth will wear down and chip and crack.
And not evenly as well.
And not evenly as well.
And some people mask it with aspirin or drugs when really there's that problem that they need to deal with.
So many people have this problem, and they think that, well, I work on a computer, or it's my job, or it's all these different things. We actually have an example of a patient here that we have some photos where, this patient had problems, and he was always going to the chiropractor and could never figure out what the problem was. And when you look at the before and after, you don't see a huge difference. Yes, the bite's a little different, the teeth are a little, and it's cleaner. So what we did is we took out some of the old dental work and made the teeth the right height, made them even, and then those muscles started working evenly. And look at the face. When those muscles start to work evenly, you'll see a difference in the way that the face looks.
Wow.
He looks leaner.
He looks leaner.
In his after.
We've opened up the bite, got everything nice and even, and so now those muscles are working evenly.
So if you're going through those little Advil bottles really quick and you have no idea why you're still having these headaches, maybe it's time to see you.
Right. If it's a bite issue, we will definitely find out what the problem is. And our success rate is very high in treating neck pain and headaches.
Wow.
Now, if someone wants to get a hold of you to do this, how long does it usually take?
That's a good question. It depends. Sometimes we can have patients out of pain within a few weeks. Others it might take a couple months. So it really kind of depends on the patient.
Excellent. And if they want to book an appointment, it's as easy as calling or just showing up?
Yeah.
All right, cool. True Dentistry. Also, by the way, they're great for not just the TMJ stuff, but general dentistry as well.
Right, and that's the thing. This all kind of relates into what I do in smile makeovers and reconstruction, because if I don't have the bite lined up, any cosmetic dentistry that I do will not be as successful.
Yeah. Well, it's a pleasure. Thank you so much.
Thank you.
Great to be
All
on.
right. True Dentistry. They're located on West Post Road, southwest portion of the valley, right at the elbow of the 215. You want more information, just head to the website or call the number.